How does Paget's disease impact bone health and mobility? Have you ever wondered how Paget's disease affects your bones and your ability to move? Paget's disease of bone is a condition that disrupts the normal process of bone remodeling. Instead of maintaining a healthy balance, the bones grow larger but become weaker and more disorganized. This abnormal remodeling leads to fragile and misshapen bones that can cause pain, deformities, and fractures, all of which can significantly impact mobility and overall bone health. In detail, Paget's disease speeds up the breakdown and formation of bone. However, the new bone that forms is structurally abnormal. It tends to be less dense and more brittle. As a result, bones can bend or enlarge in unusual ways. For instance, you might notice bowing of the legs or curvature of the spine. These deformities can put extra stress on the joints, increasing the risk of osteoarthritis. This condition can lead to joint pain and stiffness, which can further limit your ability to move freely. Common areas affected by Paget's disease include the pelvis, skull, spine, and legs. When the spine is involved, the enlarged bones may compress nearby nerves. This can cause pain, numbness, or tingling in the limbs, making it harder to move and function. In the skull, overgrowth can lead to issues like hearing loss and headaches. Additionally, the fragility of the bones raises the risk of fractures, even from minor injuries. These fractures can severely impact your mobility and overall quality of life. There are also systemic effects to consider. In rare cases, when multiple bones are involved, Paget's disease can lead to elevated blood calcium levels. This can cause fatigue and weakness, indirectly affecting your mobility. In very rare instances, Paget's disease may lead to bone cancer, which can present with severe pain and further compromise bone integrity. Treatment for Paget's disease often involves medications known as bisphosphonates. These medications help strengthen bone by slowing down the abnormal remodeling process. However, it is important to note that their effectiveness in preventing deformities or fractures is still being studied. In some cases, surgery may be necessary to correct severe deformities or fractures, helping to restore function and mobility. When we look at Paget's disease in the context of osteoporosis, we see some similarities. Osteoporosis is characterized by decreased bone density and an increased risk of fractures. Paget's disease, on the other hand, compromises bone strength through abnormal turnover and structure rather than just simple bone loss. Both conditions increase the risk of fractures and can impair mobility, but Paget's disease often leads to localized bone enlargement and deformity, while osteoporosis typically causes uniform thinning of the bones. Understanding Paget's disease alongside osteoporosis emphasizes the importance of maintaining bone health. It's crucial to monitor for any bone pain or deformities and seek medical evaluation for early diagnosis and treatment. This proactive approach can help preserve mobility and prevent complications. Always consult with healthcare professionals for personalized advice and treatment options tailored to your specific needs.